Hi, everyone. Thank you so much for coming. My name is Rebecca Klein. I'm the publisher of New York Focus. If you don't know who we are New York's only statewide nonprofit newsroom. We cover what happens in state politics and state government and how it trickles down to impact communities throughout the state. As you know, much of the new mayor's platform relies on the state to enact the agenda that he wishes to enact. So we're going to be really busy the next 4 years, so we're very excited about that. This is our first event in a series we're calling The Next New York to unpack how campaign promises become a reality. We have a few more events in the next few weeks. If you like it, please let us know. If there's something you think we should change, please let us know. We're very open to feedback and we're excited for the future, so just let us know what you think of it when we're done. Tonight we're going to be talking about childcare, an issue that is so near and dear to many of us. It is the second most expensive item per month for most families, behind housing. It is in New York what most families say totally unaffordable, and yet they have to pay for it anyway. It is something close to my heart. I have 2 kids in childcare, one who is in 4K at a center, one who is in a group family childcare center. He's almost 2. And even though 4K is free, we still have to pay $1,200 a month for aftercare because the school day does not match the day of a working person. So that's something we'll be talking about a little bit more today. We have great panelists here today. We're going to talk about the campaign promises made by the mayor, how Albany relates to it, and how to enact his agenda for universal child care. Just a few weeks ago, the governor said that she was going to be funneling billions of dollars to expand 3K and 4K and to create a new 2Care program starting in high needs areas and then eventually expanding to all 5 boroughs. So we're going to be discussing the challenges and opportunities there. And we have some really great experts here who I'm going to ask many questions. And then at the end, you all will have a chance to ask questions and pick their brains too with a Q&A. So they can come on up. Okay, first here we have Lauren Melodia. She's the Deputy Director of Economic and Fiscal Policies at the Center for New York City Affairs at the New School, which is a mouthful. And she has researched these issues for years. Her most recent publication looked at the challenges facing family care providers. And then we have Doris Irizarry, the co-founder of ECE on the Move, a collective of almost 600 early childhood educators in New York City residential settings. And Doris previously operated a residential-based family care center in the Bronx for several decades. Yes. And then we have Kathy Wylde, who retired from her job running the Partnership for New York City on Tuesday. Is that correct?
Oh, right. Congratulations.
So her first order of business in retirement is appearing on a New York Focus panel, and we're so happy to have her. In her role running the Partnership for New York City, she worked with business leaders, the most prominent businesses in New York City, to advocate for their interests, and she's written and advocated extensively on the topic of childcare. Great. So before we dive in, we want to get a sense of who's in the room and what your interest is in this issue and how much experience you have here. So could you raise your hand if you have worked in childcare or you do work in childcare? Thank you. And then could you raise your hand if you're a parent with children who are in or entering childcare at some point? Great. Okay, so we'll get started. So first, I want to talk a little bit about what the city currently offers and what challenges remain in 3K and 4K. Just for context, In 2024, 3K programs enrolled 44,000 children across the city, 84% of all available seats, and 4K programs enrolled 60,000 children, 81% of all available seats. For each panelist, could you walk me through what you think the greatest challenge facing this program is right now?
I would say it is both measuring the quality of care, can we have more than one?
Sure.
The economics of the program in terms of making sure there are adequate salaries for people, for staffing, and quality measures in terms of outcomes, which I don't think we've seen much of.
I'm going to say something. They keep on saying quality. Quality, quality, quality. But where's the money? You know.
I did mention the money.
I know you did. But, when it comes down to it, everybody says, I want quality care. We do give quality care. We have different kind of quality care, but we do. And even though we are in residential settings, we do that. And the pay is nothing. $6.50 an hour. When you have to pay your assistant $17 an hour. Workers' comp, unemployment, disability. And that's not even the insurance of your daycare because it just doubled. Don't include the rent. And we're living in New York City now in the mountains. So everything's so expensive. But I think getting paid is important. Okay. Parents need care, right? But you have to pay the workforce. If you don't pay the workforce, eventually you're going to have slots with nobody to fill because nobody's going to be there to work. And nobody wants to work. Nobody's coming into this field to work no more.
What's the $6.50 an hour?
$6.50 is what you make, and they give you $65 for a baby up to the age of 2. So 2 hands, 2 babies, right? So I have 2 babies, and then my assistant has 2 babies. That's $16.50. That's $13 an hour. But that assistant works more than 8 hours, and if it's more than 8 hours, then overtime comes into play.
Is that home-based care?
Residential care, yeah.
Yeah.
Okay.
Okay, what can I add to the challenges on 3K and pre-K? I'm not sure if there's much, I think that the hope is that it's going to be truly universal, that it's going to meet every parent's needs. I think one of the big challenges right now is we know that it's not meeting the needs of special needs children. So I think that that's the top priority for the new mayoral administration.
Can you expand on that a little bit for people who might not know? Are these children, they don't have the services available to them in these programs, or there's not seats available for people who need these services, or?
Well, I think it's really complicated to know because, one of the things, we'll be talking about today is how there's so many different types of childcare programs in the city. They're operating under different agencies. And so there's certainly a mismatch. There's a demand for services that aren't being met through the DOE programs that could be potentially met through other childcare programs operating out of different agencies. So I think it's really hard to tell kind of, we know that people aren't getting everything they need out of pre-K and 3K. They might be going to, the private sector childcare programs. They might be getting support through the voucher program. It's hard to know exactly, with all of these different programs operating simultaneously, exactly what is the mismatch between supply and demand.
So Doris, you touched on this a little bit before, and I want to probe into this further because I think from a parent's perspective, you have this service that is exorbitantly expensive, and then you have this workforce that is vastly underpaid. And so where is that mismatch as to where the money is going?
I don't know where the money is going, but it's not coming to home base. Like people were under the illusion, they gave so much money in the budget for childcare, but we never seen it. You have family childcare educators in residential setting that have to depend on SNAP, have to depend on Medicaid, have to depend on Section 8 to be able to live. They're not making it. Even a group cannot make it. I don't know. Maybe in Riverdale you could make it. You know, you pay $3,000 a child as a provider, then you could make it, but not in the Bronx. You can't.
And what about, I don't know if you could speak to this a little bit, Lauren, what about for centers? Because we know that they're strapped too.
Well, the reason we need kind of to think about this as a public program is because most parents cannot afford the cost of childcare, regardless of the setting. You know, you think about young parents, early stage of their career. This is a public good. You know, the benefits of quality childcare are society wide, and there's long-term benefits. So to put all of that on parents up front is just the economics of that doesn't make sense. And so we have centers and home-based programs in the city that charge people tuition based on, you know, what parents can afford, not necessarily what it costs to run their programs. This is why, you know, using public contracts and thinking of public subsidies to augment that is really, really critical to making the whole thing function. And I think that's why it's exciting that we're, you know, really thinking about that. But you know, in thinking about, well, how do we make it all work? We need to make sure that the public, you know, the payments to these providers actually covers the cost of care. Isn't just kind of built on the system right now where people are kind of absorbing the costs.
I think that there was research done in Syracuse that at the end, they understood that for every dollar that the state spend in childcare, there's an investment of $7 return. So why can't they invest in the children, and at the end, you're going to get an investment back? I don't understand. The children, the provider, if you're happy doing your job, you're going to stay in it.
We're going to talk more about state investment in a little bit, but I want to talk a little bit more about the announcement 2 weeks ago about the creation of 2Care and the way it will be rolling out first in high needs areas and how it will be funded by the state, et cetera. I'm curious what each of you think about this approach and what you might do differently if you were the one in charge.
Well, I would say that any major entitlement program, which is the goal for universal childcare, is going to be very difficult for a city or state tax base to support, and that it is a mistake to let the federal government off the hook on this issue. And recently, it seems our president has discovered affordability as an issue. And I think we really should be focusing on making a case to our congressional delegation to Washington that we should have paid family leave, certainly for 0 to 2-year-olds, because attempting to provide universal care to that population is just enormously difficult and will take years for the city and state to set up a system and to figure out where funding is coming from. And paid family leave, particularly, and we should think about this, paid family leave particularly targeted to those industries where the federal participation creates incentives for those industries that are very low margin. You take retail, certain areas of healthcare, ignoring Bernie Sanders' description of some of our big hospital salaries. We really need to make the case that this is a piece of the affordability agenda that the federal government needs to incentivize, particularly, again, employers in high-wage industries and the financial services, et cetera, have a lot more leeway to be able to provide support, and their folks make more of a salary to be able to afford child care at all stages. But for much of the population, they don't have that option, and their employers don't have the margins to pick up the cost without some federal incentives. So we are looking now at the state child care tax credits for employers who provide child care centers and child care subsidies, and they're grossly underutilized. Unfortunately, these laws, the bills, the programs get written often, in the middle of the night in Albany without having anybody at the table who has to use the programs. And so we're working with Boston Consulting Group to survey major employers and small business employers to figure out, okay, why aren't you utilizing the tax credits that are now offered by the state that are going to waste to subsidize your employee child care, and what can we do to change those programs to create better incentives? So similarly, there is a federal tax credit for employers, but it's very, very limited. It's so small that it's almost useless. So focusing on how to encourage employers to pick up more of the tab where they can, and zeroing in on those industries and sectors and jobs and independent contractors, because they often have the biggest problem. Etsy has done a lot of work. They have in New York State 182,000 independent contractors, sellers on Etsy, self-employed people who have very difficult high costs for health insurance and really have no recourse in terms of child care assistance. So that's, I think we really have to zero in and not just talk generally about the issue, but focus in on all levels of government and what the responsibility is, on what employers should be doing, and on where we're going to get the resources to pay for it.
Yeah, I think a comprehensive overhaul and really thinking about the whole picture is really important, because we have a child care system that is piecemeal, right? It's built on the idea that women should take care of children for free. And then we've got layered on top of that different programs that either are more focused on educating young children or making sure that parents can go to work. Some of these are tied to federal funding, some of them not. So, I think really what we need to do is think about the whole picture. How do we support families with children ages 0 to 13? And all of the different programs, and not just add a new program to the pile, if that makes sense. So I know people are excited about 2Care being this idea of like, okay, we're going to figure out how to take care of 2-year-olds. But if we don't think about it in context of all of those other programs, then we're potentially going to have unintended consequences like we saw with pre-K and 3K in the city, where the focus was on making sure that there were these kind of education, these spaces for 3-year-olds and 4-year-olds to get educated in a classroom setting that diverted them away from the types of programs that Doris ran, where you've got many children of different ages learning from each other in the same space in a program that's been around for an average of 10 years or more in the neighborhood. Those programs not getting thoughtfully integrated in led to the city losing over 1,300 family child care programs from the launch of pre-K in 2014 to 2019. So I think that, really we need to be thinking about all of the different pieces of the puzzle and how they work together. And the last thing I'll mention is, Kathy did mention the importance of federal funding. A couple of years ago, we were talking about this thing called Build Back Better, the idea that the federal government was going to invest in universal child care. The federal government can easily do it. They can deficit finance anything, And so certainly they have to think about the long-term consequences of that, but the city and state can't do that. Every year they have to balance the budget. And so we have to kind of slowly roll things out at the city and state level, which means that we really have to think carefully about how to piece things together, what to prioritize first, second, third, and what the ramifications are going to be, across the sector.
So to ask you a follow-up, what would you prioritize first?
I think I would prioritize making sure that the child care assistance program actually was fully operational right now. I'm not sure how many people are aware of that program.
Could you explain what it is for folks who might not know?
Well, Doris, maybe you want to explain the child care voucher program.
If in case I would not agree with 2K, you have to take care of what's broken first before you invent something else. 3K is broken. Pre-K is broken. 14,000 children in CCAP on a wait list. Why don't you take care of those first?
So for those who might not know, can you just give a brief overview of what CCAP is and why the waiting
CCAP
list
is
exists?
vouchers from ACS. They help parents, right, that cannot afford it. So, like right now, if you have two children with vouchers in a provider's home, and she just had a baby and she has to go back to work, guess what? She's in a wait list. Even though she qualified, there's no money. How could a state so rich have no money?
So also just a couple of points about the voucher program. The idea of it is that anyone who earns up to 85% of the state median income, which for a family of four is $113,000 a year, can get a voucher to spend at a child care program of their choosing to meet their specific work hours or hours of school, you know. So it doesn't matter how old your kid is. If you qualify for this thing, then you get subsidized care. It's something that the governor has put a lot of investment in over the past couple of years. So it's really, really popular. There's over how many people on the wait list?
14,000.
14,000.
As of last week, it was 14,000 children on a wait list. How the month before was 13. So the numbers keep on increasing because every time they have to renew their vouchers, the 85%, that's no longer. You have to have special ed, be in, these are the three things, special needs to qualify, live in, be homeless. What else was it?
To get priority?
Yeah,
I don't know.
priority. I'm trying to think. I just went blank. But the income doesn't play into it. And now it doesn't matter what you have. You're not getting it.
So this is something that needs to get fixed before we just like add a new program. Because think about it, if we've got all of these kids on this wait list and then we create a new program, will the 2-year-olds on that list get access to, you know, it's just...
Yeah, they might get access to it, but how about the other siblings? How about the other kids? You're breaking up families. You know, a mother's going to run around 3 blocks to take this child. The baby goes 4 blocks. And then the other child for after school has to go to Maria that's 7 blocks away. And by the time she's finished, she has to run to work. And then if you're in 3K, you don't start before 8:30, 8 o'clock. So they cannot open the door until 7, 6:30. Independent providers, they open the doors at 5 o'clock in the morning if they have to. And if you go into problems, I was a provider that was open during 9/11. And parents, I always told them, if something goes wrong, don't worry, I won't charge you. Most providers did not charge, and they waited because they knew trains were not working or anything wasn't working. So centers are gonna do that? No, only providers. During COVID, who was open? Independent providers. We were the one taking risks while everybody else was home. And we were essential then, you're right.
I think it's another example, though, of like, we got many programs going on. Like, let's make one that really works for families. But the voucher program has a lot of flexibility to it. So I think it's an important thing for us to think about as a model for creating a universal system that really fits all families' needs.
Have either of you had conversations with the mayor's office or administration about these priorities?
Yeah.
And what was the response like to that? What were those conversations like?
Oh, he said, I'm gonna include home-based providers. I'm not a home-based provider.
Yeah, they have, that's worked because they have increasingly mentioned in both the mayor and Emmy Liss, who's now the child care czar, have prioritized that. And I think that's really important. 30 years ago, I worked with the United Settlement Housing. The settlement housing funds have always been a great infrastructure in neighborhoods and have worked on childcare among many other issues. And we worked on a report on how the city could contract with settlement funds to be the interface between government and home-based providers or other community-based organizations as well. The idea was to try and do joint purchasing, joint buying of insurance, marketing so that those costs and those burdens didn't fall on the individual providers. And
that would be great. And
see that?
this mayor,
30 years
yeah.
ago, we wrote up this report and submitted it
This
to.
mayor is willing to work with what they call home-based provider, residential provider.
Because
You know?
it provides some, one
will
is
help.
accessibility to the home. And if you have a backup, then you've got, if the provider is ill or can't care for the kids, the settlement has a backup. They can train workers, they can monitor them, they can ensure accountability. And it would fuel our neighborhood-based nonprofit system, which has really suffered in the past 2 decades from having fewer and fewer resources. And post-COVID, the philanthropy is even reduced and the government contracts are reduced. And at the same time, they've got, as I'm sure you've all read about, they have to front all their expenses and get reimbursed, and it's been a nightmare to get money. I mean, especially on discretionary grants, it can be years before the city honors grant contracts and pays intermediaries. So this would be a way to say, let's create a win-win and look at how we can reinforce our neighborhood infrastructure, those institutions that are out there in community with capacity to manage a system of home-based care in the neighborhoods and reinforce that infrastructure at the same time we're delivering affordable child care that is more in the neighborhood, accessible to people. And I mean, I think of it as an Etsy model. I mentioned that before because Etsy has created such a wonderful network in New York State of 182,000, 82% women-owned businesses that are operating from their home and operating on that platform, and they're providing them with the marketing, with the overhead, with many of the services that they need to be able to do that. And Etsy for its own employees is a model in terms of providing childcare support as well.
Let's talk about funding for a little bit. The mayor, when he was running for office, said he wanted to fund these expansions through raising taxes. The governor is proposing the state budget. Kathy, I'd like to hear more about where you think the funding should come from, because so many people worry now that if it's coming from the state budget, it's vulnerable to cuts.
Well, ultimately, and I don't think we'll have the current regime in Washington forever, ultimately it should come from the federal government as an entitlement program. You know, the cities across this country absorb a disproportionate share of low-income families, homeless families, immigrant families that need support, and the local tax base cannot support that on its own. And we've got, so I think that it's really important we think about that. Number two, I think we've got to look at creating a system that works and that you don't have expanding the government system of bureaucrats is not a solution. And so many people, I mean, so much of what we do when we create programs, we create a whole bureaucracy to oversee it, and they end up getting in the way, adding expenses, creating additional problems. And so I think we've just got to really strongly rethink and work together. And the not-for-profit community, not-for-profit social service providers through the Human Services Council has said for years and published reports where, you know, people who are dedicated to this area have said, you know, put us at the table when you're designing the program. We're the delivery of services on the ground. We're not being treated as partners. When the government was broke, when I started out in this stuff in the 70s and 80s, when the government didn't have any money, community-based nonprofits and the settlement organizations and the service organizations, UGA, et cetera, they really carried out the delivery of services in a far more economic and community-sensitive way than we have today. And I think we have to figure out how to reinforce that infrastructure. And if we have that infrastructure and we're not just layering it with bureaucratic delays in payment, et cetera, you'll get a lot more willingness from the taxpayers, whether corporate or individual, to support those efforts. And for something like childcare, I use as examples the business community when the subways were falling apart. starting in 2007, when David Patterson was governor, Dick Ravitch, the late Dick Ravitch, had a commission. He was lieutenant governor then, of figuring out how the heck are we going to pay for modernization of the subways and providing for accessibility and et cetera, changing the signals. And the business community stepped up, and we supported creating a payroll tax that's paid by corporations, not by employees. That gets confused sometimes. We supported a payroll tax. We supported twice an increase in that tax from employers in the metropolitan region. And I think once they were convinced that the government was doing everything it could to reduce inefficiencies, to reduce bureaucracy, to try and make the system run better, and then the taxpayers were willing to pay. And I think the burden of proof is going to be on government to demonstrate that that this is, one, a true need, and since the government has found the money, as famously Governor Cuomo did in his debates with de Blasio, found the money for pre-K. The governor has found the money. It may surprise you, but we already have a tax on millionaires, a surcharge on millionaires and up that's graduated, even more on billionaires. And that tax comes 92% from New York City, Long Island, Westchester, from downstate, and is one of the reasons why downstate is subsidizing everything going on upstate, or not going on upstate. And so, so just saying tax the rich means another tax on New York, downstate, the metropolitan area, which I don't think is a immediate or justifiable solution. I don't think it's going to help us grow jobs, grow the economy, and deal with all our affordability issues.
Does anyone have anything to add to that?
I would just add a couple of things. I mean, I do agree that the federal government has the ability to really fund universal child care, but we also know we can't wait. You know, I think that this is something that people were trying to fight for a couple of years ago. With Biden in the White House, it didn't happen. And so we do need to come up with some local solutions. I think that's why it's good that New York State and New York City are thinking about this. And, I think that the $4.5 billion that Hochul has allocated in her executive budget towards childcare is a real achievement, but it's not going to pay for the whole thing, right? Yeah. It's just part of it. And so we really need to kind of think through the details. What does this program really look like? How can it be efficient? How can we combine all of these different programs under one agency and make them work more seamlessly and really meet families' needs? And being able to kind of flesh out the details, I think, will help us get a better sense of how much money is going to ultimately be needed, so that we can come up with a real revenue plan for it.
But you would agree it's going to take time. So I don't think that the delay is not, hoping Congress flips and whatever. The delay is figuring out the system and how we're going to do it. And the financing is a piece of that. What the governor has done is put up the money to be able to start now and fund it. She's funding it for the next 2 years, moving forward. But the question is, with what? And that has to be answered before you're going to get support from the taxpayers to say, sure, we're happy to pay for that. Pay for what?
Yeah. But all modality of care has to be involved.
Agree, totally.
All modality. That means the independent provider, the network provider, the centers, everyone. And you stated something very important. If you could get everybody, to negotiate insurances, business insurances for daycare, because daycare insurance just double, triple sometimes. And people are going, how am I going to pay this?
And
all those things.
The governor has proposed a first step on taking on the trial lawyers to be able to reduce insurance costs. We have the highest insurance costs in the country. We have the highest jury awards in the country, the most litigation in the country, and that is costing everybody. It costs every
Yep.
daycare provider is burdened with huge insurance costs, and it applies to housing. It applies across the board. It is a major source of our affordability crisis in this state. And those are the kind of hard issues that the governor is beginning to take on. I think the mayor is supporting her on these issues. And we really all have to get educated on what is the affordability crisis about? Why is childcare, housing, et cetera, so expensive in New York, so much more expensive than in other states? And when you dig down, you find out we're creating our own problems.
How does New York compare to other cities on this issue? And are there any places that you look to as kind of a North Star as having figured it out?
I don't think anywhere in the United States is our North Star.
And New Mexico
No,
has
there's another one
claimed to
besides
be out front now.
Vermont, I think it was. I went to, and they had it right. Yeah, I think it was Vermont. I'm trying to figure out who it was, but
Vermont, New York City.
yeah.
But I would maybe
not-
suggest Montreal. You know, like Montreal decided we're going to do universal childcare at the local level. They made a model, they made it work, and now it's, you know, a national program. So I think that's something that we need to be thinking about. How can we kind of sort through some of the messy stuff here, build some models, and build the case for, you know, it being really expanded to the national.
But then in Canada, the national, the economy is so different than ours, and the national government and the province governments are much more sensitive on these issues.
But I think before
There's much less inequality of wealth.
I think before we attack anything else, this wait list have to be taken care of. Parents, if parents can't get to work, it's going to affect. It's going to affect workers, you know, companies, you know. Those are things that's going to happen. It's going to affect our community. But 14,000 children on a wait list, that's ridiculous.
We're going to go to audience questions in a few minutes, but can you paint a picture of kind of the massive administrative project that will need to take place to start To Care, and kind of what are the tasks before the city on this?
Well, I think one thing that I've noticed in our research is the city has to get a better handle on where the child care program seats are. Right now, because we have programs operating out of ACS and DOE, you can't create one the city doesn't have one comprehensive list of all of the seats. And so when you think about kind of expanding subsidized care, contracted care for 2-year-olds in a particular neighborhood, you really have to be looking carefully at like, where are there open seats available, and how do we bring those providers into the system without creating a lot of new hoops for them to jump through, so that their existing program can serve the need. So I think like understanding, so I think that's one thing, is just like putting it all under one umbrella, making sure that there is data sharing across those programs. Doris mentioned the wait list. There's also a lot of empty 3K seats in the city right now. The fact that those two agencies didn't figure out how to talk to each other in the past year and make sure that those kids on that wait list could get access to those seats that were already allocated in the DOE budget is, I think, an example of just kind of the piecemeal system we have, and the need for getting it all under one umbrella and thinking about, how to make it easy for parents and providers to access a system, rather than hoops here, hoops there, that kind of thing.
There was a lot of vacancies for 3K, especially the 3Ks that are being run from home-based providers. I know providers that have only 1 kid, 2 kids, that's it. Or 3 kids, they were limited to 3 or 4 kids, that's it. When you have so many kids that are in the wait list. So you're right.
I think that this is a matter of how you approach it. If you wait for city government to figure it out, it will take forever and the results will not be great. I think if they would contract with the responsible groups that are expert on various areas of childcare and human services, the nonprofits in particular, the network providers, Tara, yourself, others, put them at the table, give them the assignment, give them some money so they can hire consultants to support their work and let them design a system. And I think that's the fastest way and the most effective way to come out with good results, and ones that are sensitive to the differences in our neighborhoods across the city, to the differing needs, to special needs. Those are all reflected in the priorities of the not-for-profit groups, and they have not been at the table for 20 years in terms of our delivery and design of social service programs and support programs.
Awesome. Thank you so much. Now we're going to take some questions from the audience. So Jennifer is going to be coming around with a microphone for those who have questions.
Or comments.
Hi, my name is DJ. I work in family defense. So I work in an organization that helps to keep families together who have been targeted by the family policing system, otherwise known as the child welfare system. The people that I work with are often accused of neglect for crimes of poverty, like not being able to afford food or childcare or other basic needs that they otherwise would like to provide for their children or their families. So universal childcare would obviously be a hugely positive impact for many of the families that I work with, but I'm concerned that if universal childcare providers are mandated reporters, which they almost certainly will be, and those mandated reporters are then, perpetuating the harm of conflating poverty with neglect, then more children will be exposed to people who don't understand their family circumstances and may be reporting them for crimes of poverty when they actually just need support. So I'm wondering what your suggestions or ideas are for supporting families in these situations in this universal child care model versus reporting them.
I could answer that. I had children where the parents couldn't afford food. And as a provider, I understand when you don't get your paycheck in time or you're a contractor worker that you might not have food. So I always had a pantry in my house, and I didn't call nobody. I helped them because, like you said, the difference between negligence and poor is two different things, And the children would say, oh, mommy didn't get paid or dad didn't get paid, and we don't have food at home. And I would say, okay, we have a pantry. Let's go get what you want. Let's go see what mommy needs. And that's how most providers work. They don't call. Mandated reporter is a different thing that if you know that they don't have food, they poor and negligence. Those are two different things.
Hi,
I'm sorry.
Hi, my name is Mika. I'm a correspondent in Nikkei from Japan. So I don't know how many questions I can get, so I'm going to ask one question to Catherine Wylde. I'm just curious on how much support, or I guess disagreements about the expansion of better child care credits for employers, and opinions you're hearing specifically from Wall Street executives or CEOs and just business leaders in general.
I couldn't quite understand
I
how
couldn't
much.
understand.
Just what specific voices you're hearing about the potential proposals or plans about expanding, or the idea of expanding childcare tax credits.
There's interest in it. We surveyed about 100 companies of our members, employers of various sizes, and in different industries, and asked them what they were doing on child care benefits directly. Were they taking advantage of either federal, state credits? And if not, why not? The biggest response was from those that are investing, and for those that are not investing, the biggest response was, we don't know about any of those state credits or federal credits. And the second response was, the bureaucracy surrounding getting the credits makes them not worth bothering. It's too expensive and takes too long and wasn't working, particularly with and the federal credits are so de minimis that it wasn't worth the bother of applying for them. So there is an interest, but again, as with the service providers, you have to put the employers at the table when you're designing the program and get the commitments up front that if you do X, Y, and Z, we will take advantage, we will invest, we will match whatever you're trying to accomplish. And that hasn't been a way that's, stuff in Albany gets written in the middle of the night. God knows where the stuff that comes out of the city council gets written. And so we haven't had that process. And I think that's what's important. Back to the point that Lauren made, we really need a process that has the right people at the table to design the programs who understand the community needs, the needs like the one described in terms of understanding the conditions of poverty versus negligence. The right people aren't at the table to make those policy decisions, and the same thing goes for the employers.
Do you think there's an appetite in Albany right now for reforming that process, or?
With the governor, absolutely, and she's going to push for it. Yes, absolutely, and I've had those conversations directly, so I know that.
Sorry, I already have the mic. Hi, my name is Maya. I have two questions, I think one for Doris and one for Kathy. My question for Doris is, if you could ask for two things for the kind of providers that you are and that you and the providers that you work with through ECA on the Move. What are the two things that you would really want to make sure are incorporated into the new universal childcare programs, as they're being built out? And then my question for Kathy is, you named that for decades, organizations haven't gotten a seat at the table in designing these programs. And I'm curious what your read is on what the obstacles have been for making that possible, and if you think that there's reasonably an opportunity for that to happen under the current administration. Thank you.
Okay. Two things I would like for providers with universal child care. The first one is cost of care. We need to cover that cost of care to where you're not struggling. How about benefits? We don't have benefits, do we? Retirement, 25 years. I don't have nothing to show for. The family, yeah, but I don't have nothing to show for. Benefits, retirement, vacation. What else? Sick time, that's right. We have providers here. What else will you like? Holiday pay. And the wait list gone. That's it.
Simple.
No. Let's have a wand, a magic wand.
Now I've forgotten my question. What was my question?
Thank you. You mentioned that.
Do I think Mamdani?
Oh, well, yeah.
20 years.
Yeah, what does it take to make sure that these kinds of organizations get a seat at the table in the program design, to your mind?
I think that I put together a group in October, pre-election, of a broad range of service providers that I had, nonprofit service providers that I have great respect for. I put them on a Zoom with then the candidate Mamdani and his chief of staff, and some of his other support staff in the campaign who are now in city government. And they heard the message, and I think based on the response, I think it really resonated. So I think it's follow-up. and making sure that we continue to press. They have gotten in touch with many of the major service providers since the election. A number of them were on the various transition teams. So I do believe that he is uniquely in a situation where he can break through some of the biases, which I think have come from sort of historic power situations. I mean, in state and local government, the people who work in state and local government basically get punished if something goes wrong. There's really no benefit if things go well, but they really put their tail on the line if things go wrong. So they've created many layers to keep other people out, to keep, to make it their province, to be able to control what happens, to monitor. I tried, we ran a program during and toward the end of the pandemic with Breaking Ground, the homeless service provider, and they do a lot of the outreach contracts for the city. They're one of the 3 major groups that do homeless outreach. And we raised private money to pay them because the city contracts don't allow them to go into ATM terminals or follow people into private stores or whatever that they can't, so they lose track. And under the system, we set up a direct line to the outreach teams, the folks who were on the ground going out working for Breaking Ground, and employees of companies that had contributed. And literally thousands of employees were calling up when they encountered a homeless person to let the outreach team know there's this person here. And we ended up Breaking Ground in the 2 years of that program. They had a 30% better placement record under our program than they did under the city contract. And the big difference was the outreach teams were getting the information directly and following up and reporting back to the person who reported it. Whereas if you call 311, which is the option, or 911 if it's a violent encounter, very often it goes into what happens is 311 sends the call to Department of Homeless Services, to DHS, and they cogitate about it for God knows how long, and then finally tell the outreach team, and of course the person is long gone. And it was just it was one indication. And I got everybody on a Zoom from the city that was in charge, the people in charge of 311 and IT and HRA, et cetera, homeless services. And there was no way that either 311 or HRA and homeless services would give up their control of the information so that it could work better. And that's just a microcosm of kind of the mentality. It's not that these are bad people. It's just that their accountability system, things can only go wrong if they delegate. And, you get the front page of the New York Post saying some nonprofit has stolen $2 million from whatever, and everybody's head rolls, or many heads roll. And so I think that culture we have to overcome. And as I say, when the city was broke and didn't have staff and all that in the 70s and 80s, we had the nonprofitization of those services, and the nonprofits really had a say, whether it was in social services, homelessness, housing, whatever, workforce. That's totally deteriorated with this mentality. And I think we've got an opportunity, and I believe Mamdani is open enough to new ways of doing things and changing the culture that there's a shot. But they've got to hear from everybody that we really want to see this come back to the community, come back to the providers, and not be this top-down dictating how we're going to solve these problems, because it's not working.
Hi, I'm Sydney. I'm a parent, and I'm also a volunteer with New Yorkers United for Childcare. And as a parent, most of my conversations after becoming a parent are about childcare. I guess the costs, the lovely parts of it, the frustrations with having to figure out summers and aftercare and all of it. But what role do you think each of you think parents can play in advocating for the best possible programs, making it more effective, more efficient, and just getting it out there better and faster?
A parent has a voice. Your voice is important. Without the input of parents and providers, there's not going to be a universal child care for all. Parents have to be in that table.
I think a great model, if you followed it, was what the charter school parents were organized to do, and kids during school. But that was, I mean, I have not seen in the last 20 years a more effective advocacy movement than the mobilization of the parents and often the kids and the teachers to mobilize the support and the financing for charter schools in the face of a lot of resistance. And I'm not saying one way or another agree or disagree with charter schools. I think that is a model for the kind of parent activation that and parent activation with support and organization that could make a big difference.
Another thing I would just add, I think we need to hear more about what parents need in terms of childcare and understand that there's no one-size-fits-all approach. And this is why it's really important for parents and their childcare providers to be working together to think about what does this system look like, We don't have unlimited funding for this, so we have to think about what the trade-offs are. Are parents more interested in making sure that childcare covers their work hours, or that there's a particular type of curriculum in place? Do they want to be able to bring all their children to one location? One of the things that Doris mentioned. So, I think parents know what their needs are, and then their providers, have been working in this system for so long, and they understand, all of the regulations and the challenges. And so I'm hopeful that parents and providers can work together to really help flesh out the details of, what's needed and what's going to work, kind of given the existing kind of childcare fabric that we already have.
Thank you so much. So it's past 8. If folks have more questions and you guys are willing to stick around and answer questions, then we can continue. But if you need to leave, please feel free to do so as well. But we can take more questions if folks have them.
Hi, my name is Eleonora, and I just wanted to go back to something that I think Lauren said about the opportunity, but also the challenge of a new program and looking at the overlapping regulations by different city agencies. And my question was, when it comes to regulations around approval of data collection, of quality assurance, are there different regulatory agencies that are excelling or failing at different areas of that might provide the kind of model for what kind of program you're talking about? And maybe particularly for independent caretakers, what kinds of regulations are particularly onerous for you, and what kinds are really necessary for you to do your jobs?
Well, we're mandated by everyone. We're mandated by OCFS, we're mandated by ACS, we're mandated by, OCF,
Department of Health.
Department of Health. Who else?
Consumer Affairs.
Everybody. Let me put it this way. If you're in the network's in your house. Full program is in your house. Everybody comes. And there's unannounced visits. There's courses you must take. You have to always be on top of your game because you get a violation. You don't want a violation. 25 years, I know. I hate it, seeing them and not having things. I used to go through my notebook, checking everything. Let me check the outlet. Let me check the fire drill. Let me see this. Let me see that. And I lived in a house, so I had to go around, make sure everything was in place. The fence was a certain height.
And this is something that the mayor has already issued an executive order on trying to clear up for small business all the redundant permits and regulations and
And that-
craziness. And that same principle, so I'm pretty confident that if it's approached with, a documentation like this of what's involved, same thing with creating a center, like employers who want to build a center in their office so that their employees can use it. It's just the regulations are so impossible. There's just no way.
We take so many courses. I have so many diplomas in my house, that my co-partner said, you know what, Doris, if we take all those diplomas, they would have given us credit, college credit. We maybe had a master's. How about that? Because we're always studying. I'm always looking into something. I never knew the world of autism into 21 years ago. I didn't know the world of autism. And I told her, you know what? You're willing to teach me, I'm willing to learn. You teach me and I'll learn. To this day, Miss Priscilla Wilson, me and her still have a connection. My first grandson is autistic, and she taught us the rope. I already knew. My daughter said, Mom, I think Evan is autistic. And I go, I think so too. The doctors did not give him that evaluation, but because of this, parent taught me something I knew. My grandson learned how to read at 3 years old because my daughter learned from me. She's an advocate for parents now in a special needs school. She advocates for 3 schools.
We need to
for
replicate
parents.
you.
What I'm trying to say is parents are important, but providers and parents could work so well together. ECE have not only parents, we have providers and we have parents. A parent will call me and tell me, I need childcare in 10473. I have a chat. We put it out there. We have 700 providers, all different. Network providers, 3K providers, independent providers, but they're good at what they do. I hope I answer your question.
I have a super fun question. It's about insurance. You guys said that insurance is a really high cost. Is there anything that either level of the government, city or state, can do to control this cost? And if they haven't done anything, what is there a world where this might exist, where they either have better control over it or it's like, I don't know, state funded or something like that?
I think if they negotiate, like unions could negotiate, right? For healthcare, they could negotiate for insurance and get everybody involved, and it wouldn't be so expensive. But the unions have to be involved too. Everybody has to be involved, city, state, and union.
So the insurance issue, though, is really a function that the most powerful lobby in Albany is the trial lawyers. And the cost of litigation is all reflected in insurance rates. And childcare is particularly high risk, expensive, damage to a child, whatever. Big source of litigation. We've got the same problem with medical malpractice across the board. And the governor has provided the first courageous effort in her budget message and her budget, which is going to take a lot of support to be able to curb that. She's starting with car insurance because our car insurance, the level of staged accidents in New York is the highest in the country. It's 95% of the claims that are coming into the Department of Financial Services at the state are staged accidents, fraudulent medical claims, and that unless we can cut those costs, that's all passed on to consumers. And so she's starting with auto insurance and home insurance, but this will apply to government. And this is the first step at being able to tackle this. And your point is right. We really need the unions to support us in that effort. And it's not, I wish it were as simple as the insurance companies are making big profits. Unfortunately, that is not the case. It's the trial lawyers and and some fraudulent medical claims are making huge profits. You can see it in the level of advertising they do. And that's what's costing so much. That's in Brooklyn, where I live. Our car insurance, a full load car insurance is $6,000 a year now, which is ridiculous. And our average in New York State is 52% higher than the country. So it's just, these are all New York laws that could be fixed.
I think we'll take one more question, and then people are welcome to hang out for a drink. We'll be around.
Hello, my name is Rex. I'm representing the Democratic Socialists of America, Afro-Socialism, and People of Color Caucus, mouthful. And I also work in healthcare. So this is an issue I don't have too much prior knowledge of, so I'm learning a lot tonight, and it's really fascinating. But I was hoping you could dumb it down for me in more of a global sense and analogize better to what I do know. So in DSA, we're very much a fan of universal programs. And like, for example, in healthcare, we're pushing for the New York Health Act with the understanding that it costs a lot of money to maintain the existing patchwork where you have to hire people to basically deny access to care. Whereas a universal program where you just assume that people are eligible from the beginning can, in theory, save costs. Is that an accurate analogy that could be applied to childcare, or are we in a regulatory framework where that just is not possible?
I don't think the administrative cost of figuring out who's eligible for different programs is like the big driver of the cost of childcare. And so, I think universal programs, one of the things that's really amazing about them is because they're for everyone, we can get the political will behind them to fund them. You think about what the Trump administration has done over the last year. They've been attacking programs that serve poor people, Medicaid, SNAP. They have not been attacking Medicare. They have not been attacking Social Security. Those are universal programs that have, broader support because they support everyone. And so I think certainly, that's why we should be thinking about childcare as a universal program as well. We know that most parents can't afford the full cost of childcare, and so we do need to think about a universal program. But I think one of the things that I hope has been kind of made clear here is that when we're talking about universal childcare, we're not talking about putting it in public school buildings. Mm-mm. We're talking about utilizing the existing childcare programs that are in community centers, in home-based childcare, in residential settings, that people are already utilizing, and just making sure that government can use its resources to make it affordable and accessible to everyone. And so there's a really unique thing going on here in that, and maybe this is similar to thinking about, health insurance in the sense that at the end of the day, you're going to the doctor in your neighborhood that's not, a state employee, but, working at a nonprofit or, a family practice, that kind of thing. But it's trying to figure out how kind of the government can be working better with these existing programs so that they're able to be fully staffed, have all of the supplies and support they need to provide high quality care. And so I think that's one of the things that's really challenging about childcare is thinking about this mixed delivery system that we already have that's already very fragile because we don't have broad support to fully fund it, figuring out how we bolster and stabilize that system to be able to care for more children as it becomes universal.
I think universal childcare is needed, not only for Democrats or Republicans, they both in need. Republican and Democrats and independents should be all in the same table, agreeing that universal childcare should be the one that will work. It's from 0 to 13. Because last year I went to Albany and the assistant to one of the legislator, he was telling me his wife had to stay home because they couldn't afford childcare. So it's not only us, it's them too. It's everyone. It affects everyone. So I think if they will all agree, because all their constituents, either, I don't care who they vote for, all their constituents are going to have issues with childcare. When you have a baby, some people have to put their baby in a list before it's born, 6 months before.
Awesome. Well, thank you so much, everyone. Thank you so much to our panelists.
Thank you.
We so appreciate it.
Oh,